was 17, I got my x-ray license for dental x-rays in the state of California. And then while I was at undergrad at UC San Diego, I worked as a part-time dental assistant. And that's what kind of got me started in dentistry. I went to dental school at the University of Southern California, and there is where I found my love for surgery, and then dedicated myself to becoming an oral surgeon. So I practiced in the East Valley for a few years, and then I came to a point where I was ready to have a practice of my own. And then I looked into the city of Surprise, and I saw that it was going to be a great fit. As an oral and maxillofacial surgeon, we do 4 additional years after dental school, at least 4 additional years in a residency that's hospital-based. So we train with very sick patients, we learn anesthesia, and we learn anything from pulling teeth out to full facial reconstructions. In the Surprise office, the typical procedures that we would do is anything from a dental extraction to bone grafting, dental implants. We do full general anesthesia as well, and biopsies, etc. And then in the hospital setting is where we can do full facial reconstructions, take out larger tumors, fix all types of facial trauma, and treat some of the more sick. Here at Surprise Oral Implant Surgery, our primary focus is excellent patient care. In our practice, communication is definitely key, and that's evident from any staff member up to myself. We always try to make our language very clear, concise, but also at the same time understandable, because we don't want to have any miscommunications or anything. And that has to do not just with the actual surgical treatment itself, but also when it comes to financial planning and things like that, so that there's no surprises to the patient and they know what they're expecting from us. We try to provide a very lighthearted, friendly environment for patients. We definitely understand that it's uncomfortable to be seeing an oral surgeon after already having seen their dentist. I believe in volunteer work because the community in general, especially the community of Surprise, has been very receptive to us, and they've treated us very well. And it's definitely our way of giving back to people in need in the same community that's taken good care of us. I routinely participate in the Arizona Mission of Mercy, free dental clinic type days in other dental practices in the community. We're also part of the Dental Life Network. Surprise Oral and Implant Surgery is invested in this community, and we are invested in the Chamber of Commerce.